basically the gallstones are usually diagnosed on an ultrasound, and the ultrasound is the most sensitive investigation to diagnose gallbladder stones. Most of the time, many times patients with gallstones have the typical gallbladder symptoms. Those patients are called symptomatic gallstones. But on the other hand, a lot of patients are also diagnosed with gallstones in the absence of symptoms. These are patients who undergo a general health checkup, a whole body checkup as a part of a general health plan, in which the stones are picked up with no history of any abdominal pain in the upper abdomen. Then patients who are undergoing ultrasounds from other reasons, like for example for gynec problems, for fever, loose stools, and other symptoms which are not attributed to the gallstones. Also, then you have a third group of asymptomatic patients, basically where the gallstone pain is a very typical pain. It occurs in the location of the gallbladder, that is in the upper abdomen or on the right side, and this pain is a very memorable kind of pain. The patient will say that, on that particular day, at that particular time it started. So sudden onset pain, fairly moderate or severe pain. It's usually after a meal. It starts in the middle of the night, in the late evening or the middle of the night most of the time, and it lasts for a couple of hours and then subsides by itself, and it goes to the shoulder or the back, and it's associated with vomiting. So these 7-8 characteristics, when they have, we call them gallstone pain. So when patients have other pain in other parts of the body, on the left side or the lower abdomen, even those symptoms are other GI symptoms which are not attributable to the gallstones. Even those patients, we call them asymptomatic gallstones. So asymptomatic gallstones basically constitute patients who don't have any symptoms attributable to the gallstones. They could be a part of an asymptomatic patient as a part of a general health checkup. They could be found out while evaluating for some other abdominal problems, or patient may have come with pain, but we think that this pain is not due to gallstones. So these three categories of patients, we call them as asymptomatic gallstone patients. So a lot of patients who have gallstones are worried, keep on getting ultrasounds about the size of the stones. I have 3 mm, I have 8 mm, it has increased in size, decreased in size, now I have 3 stones, now I have 5 stones. So the size and number of gallstones does not matter. So we should differentiate gallstones from kidney stones. Gallstones are different from kidney stones as much as apples are different from oranges. Kidney stones, it's all about treating the stone and not the kidney, and the size of the stone, number of stones matters. In the kidney, if it's a very small stone, it will slip down in the urine, and if it's a bigger stone, if patient has no symptoms also, it requires treatment. While in the gallstones, the size and number of stones has zero relevance. So the symptoms is the only thing that matters. If a patient has gallstones and typical pain, even if he has a single 2 mm calculus, 2 millimeter stone, I'm saying, even if you have a very small tiny stone also, it requires treatment. On the other hand, if the patient has no symptoms whatsoever, no pain attributable to gallstone, no pain in the upper abdomen or the right side, the typical pain we spoke about previously, the sudden onset severe pain in the upper abdomen, if the patient doesn't have those symptoms, even if he has a 15 stones or 20 stones, it doesn't require treatment. So the size and the number of stones are not an indication for treatment, because in gallbladder surgery, gallstone disease, the treatment is not directed to the stones per se. In kidney, the treatment is directed toward the stone, while in gallbladder, the stones are only a marker of improper gallbladder function, so the treatment is directed towards the gallbladder. So in summary, when you have gallstones, the size and number of stones that you have does not dictate treatment, as the treatment standard is to remove the gallbladder with the stones. It is only the symptoms that matter. If you have symptoms, irrespective of the number or size of stones, you need treatment. If you don't have symptoms, irrespective of the size and number of stones, you don't need treatment. Obviously, gallstones are extremely common in the world. I mean, in places like the cow belt in the northern part of India, where UP, Bihar, West Bengal, that area, the incidence of gallstones is so high that it's almost 1 in 10. So 10% of the population has gallstones. So the burden of gallstone disease is huge. And in that, a lot of patients have asymptomatic gallstones. So just gallstones, when you undergo some test or something, you're found to have gallbladder stones. So, and you don't have any symptoms attributable to the gallstones. So what do we do for these asymptomatic gallstones? So for these, a lot of studies have been done, and we have clear-cut scientific data about this. So in some of the studies, they've studied up to 40,000 patients over a period of 30 years. So 40,000 patients with asymptomatic gallstones, they followed them up for 30 years. And after 30-year follow-up, out of the 40,000 patients, only 10% develop symptoms. That is, 90% of the patients, even after 30-year follow-up, did not develop symptoms. The other problem with gallstones is patients with symptoms can have complications. So if you have symptom, that is the pain which I described, the sudden onset severe pain is called biliary colic. If the patient has an episode of biliary colic, he is at risk of complications. So the complications are the stone can get obstructed in the neck, cause acute cholecystitis, it can cause pus in the gallbladder, it can cause gangrene of the gallbladder, it can cause perforation, it can slip into the bile duct and cause jaundice, it can cause infection in the liver called cholangitis, it can slip down into the pancreas and called pancreatitis. So all these pancreatic problems, so a person with asymptomatic gallstones may worry because all these complications are pretty serious and they have very high risk. So one of the concerns is, I may not have symptoms. What if I directly get a complication, which is a life-threatening complications? So this has also been studied. So over 30-year follow-up, 90% of the patients did not develop symptoms. Only 10% developed symptoms, and only 1% developed complications. So out of 100 patients, only 1 patient developed complication in 30 years of follow-up in asymptomatic gallstones. So and the most of the time, it was found that the patients who developed the complications had an episode of symptom before. So the standard dictum is that if you have gallstones and you have no symptoms, there's a very likely, there's a 90% chance that you may never get symptoms ever in your life. So you need not have treatment and you can just follow up. But once you have a single episode of symptom, if you have a single episode of symptom, the risk of these complications, acute cholecystitis, gangrene, perforation, cholangitis, jaundice, pancreatitis, some of them like pancreatitis and cholangitis are a pretty high risk conditions with almost 20 to 30% mortality. So if severe pancreatitis. So if you have once you have symptoms of gallstones, the typical biliary colic which I mentioned, the risk of these complications is 4 to 8% per year. So once you have symptoms in the next 10 to 12 years, you will inevitably develop a complication. So treatment is mandatory. If on the other hand, if you're asymptomatic, there's a 90% chance you'll never develop a symptom, and if at all you develop a complication, before that you'll get one episode of biliary colic. So based on these recommendations, in the Western data, especially where the healthcare is mostly government sponsored, so the way they looked at it is, so let's say every in the US or UK, gallbladder surgery would cost, let's say, about $30,000. So $30,000 into 100. So that will be like, $3 million to prevent one complication, because only one complication occurred in so much. So based on that economic model and also the common sense, because we're doing a lot of unnecessary surgeries, it is recommended that patients with asymptomatic gallstones need not undergo surgery, but if they ever have an episode of pain in the waiting period, they should immediately go for a laparoscopic cholecystectomy. There are some situations where patients with asymptomatic gallstones, we offer them surgery. One such situation is in the younger patients, in less than 30 patients, the teenagers and less than 30 patients. And so in them, once you have gallstones, you're going to have gallstones for the rest of your life. When you're 30, 40, 50, 80, even if you live till 120, you're going to have gallstones. So the lifetime risk of stones in the younger patients of symptoms and complications is very high. So usually when we see gallstones in the younger group of patients, we prefer to offer them surgery. One more category is in young women who are yet to start their family. So in women, usually during the pregnancy, because of the high progesterone levels, the gallbladder function worsens, and patients who don't have gallstones actually form stones during pregnancy. And the patients who already have gallstones, their symptoms may worsen during pregnancy. So in the young women who, if you're planning to start their family and have kids, if they have gallstones, that's one more situation where we ask them to undergo surgery. Then the third situation where we ask asymptomatic gallstone patients, we offer them surgery, is if they're having any other abdominal surgery. For example, a patient with asymptomatic gallstones, which we are following up, if he needs to undergo surgery for some cancer, or if he needs to undergo surgery for a hernia or some other condition, because the gallbladder surgery is a very simple surgery, it's a very, very safe surgery, the risk of complications is very low. There's something called bile duct injury which you're worried about. The risk of that is less than 1 in 500. So it's a very safe surgery. So in case the patient has gallstones which are going to be there for the rest of his life, and he's undergoing another surgery for, let's say, for hernia, colon cancer, or any other abdominal hysterectomy or any other abdominal pathology, because patient is going under GA and patient is anyway undergoing a laparoscopy, if he has gallstones, we offer cholecystectomy. So these are the three situations: in young females, in younger patients, patients who are undergoing any other abdominal surgery, and sometimes there are other specific situations like patients who are having needing chemotherapy in symptomatic gallstones and all that. In those kind of patients also, it's a debatable thing. One of the reasons sometimes surgeons and physicians say that you are diabetic, you are at a higher risk of developing complications. So even if you have no symptoms and you have gallstones, you should undergo laparoscopic cholecystectomy. That is not true. We have a lot of data which has shown clear cut that diabetics are not at an increased risk of developing symptoms of gallstones. The diabetic patients with gallstones are not at an increased risk of developing complications of gallstone disease. Yes, if you have very poor uncontrolled diabetes and you develop a complicated gallstone complication, then because the uncontrolled diabetes, your risk of life-threatening issues is more, but per se, in terms of the incidence of complications and incidence of symptoms, it is the same. So indications for surgery in diabetics with gallstones remain exactly the same as the general population. If you have symptoms, treatment is mandatory. The symptoms meaning the typical biliary colic. If you don't have symptoms, you don't need treatment. One category of patients with gallstones are patients with a lot of non-specific abdominal symptoms. Patients have gas, bloating, indigestion, dyspepsia, constipation, diarrhea, a lot of vague abdominal symptoms. One of the mistakes we do is that we sometimes attribute these symptoms to gallstones, and then we do the surgery, the symptoms don't resolve, and patients starts blaming the gallstone surgery for his symptoms. One thing we have to realize is the only symptom that is clear cut attributable to gallstones is the biliary colic. The gallstone, upper abdominal right upper quadrant pain, which is sudden in onset, short lasting, late evening and early morning hours, short lasting, self-limited, associated with nausea, vomiting. If you have only this pain, this is related to your gallstones for sure. And once you have the surgery, the gallstones will be gone, this pain, biliary colic episodes will be gone, and all your risk of further complications is gone forever. But your other symptoms like this dyspeptic symptoms, indigestion, burping, bloating, constipation, diarrhea, vague abdominal fullness, these are all atypical symptoms which are most likely not related to gallstone disease. So when they looked at atypical symptoms, only 1/3 of the patients with atypical symptoms had any relief of these symptoms after gallstone surgery. So if you have gallstones and you're undergoing surgery, you should think that, okay, one is my stones are being cured, my complication risk is becoming zero, and my pain episodes which I get are getting relieved. Don't expect all your symptoms for your indigestion, dyspepsia and all to get treated with gallstones. If not, you'll be disappointed. So once you have gallstones, one of the options every patient would like is if she can take some medication to sort of dissolve his gallstones. There is no proven medication in allopathy, Ayurveda, homeopathy or Unani to dissolve gallstones. These are all false claims, and because in fact the treatment of trying to dissolve gallstones, the treatment is pointless. I'll tell you why. In 1940s or so, a tablet which we use, ursodeoxycholic acid, was used to try and dissolve the gallstones. Patients took the ursodeoxycholic acid for 2 years and then the gallstones dissolved and resolved in 15% of the patients, and once they stopped the medication, within 3 months the stones came back. Likewise, they used to actually put needle into the gallbladder and use some solvents to try and dissolve the gallstones. All these treatments failed because later on we came to an understanding that the gallstones are just a marker of gallbladder dysfunction. So normally we don't do these tests in practice, but if we do a test called HIDA scan in gallbladder patients, we find that the gallbladder function is either non-functional or very suboptimal function. Because of the abnormal gallbladder function is the gallstones form, and because of that the pain occurs. So there's no point trying to treat the gallstones as long as the gallbladder is still diseased. So there's no role of medication. The only treatment in symptomatic gallstones we know now is surgery, laparoscopic cholecystectomy. So, the traditional recommendation, as we discussed before, as 90% of the patients with asymptomatic gallstones remain symptom free for the rest of their life, is that if you have no symptoms, you need not undergo surgery. When you develop symptoms, you go to a doctor and undergo the cholecystectomy. But yes, I mean, basically, like I told you, this is based on the Western model. They found that over 30-year follow-up, only 10% of the patients develop symptoms and require surgery, and only 1% develop complications in 30 years. But so their model is basically in the government-sponsored healthcare model, where they looked at, to prevent one complication, I need to do about 100 gallstones, 100 gallstone surgeries to prevent one complication, and 90% of the patients I may avoid surgery. So that is their cost model. In India, basically, you're going to have gallstones for the rest of your life. If the patient has the question that right now I'm 40, I have gallstones, what if I develop symptoms at 60, 70, 80, 90? The evidence supports that we can watchful policy. That means we can wait and watch and treat the symptoms occur. But if the patient chooses to undergo gallstone surgery by his choice, because in Indian model is not a cost model. I mean, because in India, most of the time the patient is paying for his own Medicare. So because of that model, if the patient chooses to say that, no, doc, I need to get my gallstones treated, because gallbladder surgery is again usually a very, very safe and a low risk operation among the various abdominal surgeries. By patient choice, we can offer them surgery for asymptomatic gallstones, that is laparoscopic cholecystectomy. Thank you.